Okay, I wanted to highlight a case that we had a week ago, and it turned out to be, the patient turned out to be very, very angry after the visit, and so I wanted to talk about that, about patient management. So, first thing was this patient was in a great deal of pain. We worked her in between patients as an emergency patient. So when I talked to her and was telling her she needs a root canal, I explained that it could be a 2-visit procedure, but somehow we failed to connect on that. Either I didn't do a good job explaining or the patient failed to understand what I was saying. So at the end, I went ahead and cleaned out the tooth to get her out of pain. I placed calcium hydroxide in there. Then we brought her up to the front and we said, okay, let's make your next appointment for 2 weeks from now and we'll finish the tooth. The patient got very angry and I was working on another patient. I was now an hour late with my other patients after I worked her in. I had to come up to the front and talk to her. She was so mad that I didn't finish the tooth, and I explained to her that we worked her in as an emergency, and my whole goal was to take her out of pain, to get her out of pain. Well, her response was, I could have just taken more Advil. I can just keep taking Advil. And she said, if I would have known, I would have never let you start. And this patient has been a thorn in our side the entire couple weeks, and she's coming in about 5 minutes right now. And so I will give you an update after. But I want to highlight a couple things. Every patient you see for root canal treatment, I think we should really clearly say that it could be 2 visits. It may take 2 visits because of the difficulty of the tooth. It could be curved, long roots, or infection. We want to make sure that the infection is clear and that it's healing before we finish the case. So we have to really communicate that to our patients that it may be 2 visits, and I think that really helps when we do that. Also, any case that looks calcified, tell the patient ahead of time, this tooth looks calcified to me and may be very difficult to find the canals. That way you don't have to say it when you're in there searching for them. Okay? Say it ahead of time. Also, the third thing is I think you really should tell the patient it's going to take about an hour to an hour and a half. Okay, a little bit shorter, maybe a little bit longer, but the average is an hour to an hour and a half of treatment time. That just gets the patient mentally prepared for that. And the fourth thing, and we failed to do this part too, which is unusual, we failed to give the patient a post-operative instruction card. So this patient that has been a thorn in all of our sides now doesn't have a post-op instruction card because one of our assistants didn't give it to her. And she has called probably 15 times in the last week, complaining of everything you could ever imagine as a negative neuro association anytime she hears my voice or sees my face. So what we want to do is we want to have a better, I think my part in it is to be very clear on, it could be 2 visits, clear on the time so that the patient 10 minutes into the procedure looks at their watch and says how much longer, okay, which we get all the time. So you tell them it's an hour and a half, give them a post-op card, and tell them any problems that could arise prior to starting the case. Thank you.